So in LIGATE, what we're going to do is to create this novel, polished pipeline which anyone can use with relative ease and which can be run much faster to respond to worldwide crises like the current pandemic.
Welcome to Chelonia Podcast, a podcast about the use of scientific discoveries and of technology application. We provide the best information on projects participated by Chelonia and many more. My name is Gabriella Bernardi, I am a science journalist, and in today's episode we talk about the LIGATE project with Janani Durairaj from University of Basel. Nice to meet you, and will you please introduce yourself and give us an idea of your background?
Yeah, thank you. I'm Janani, and I'll be a postdoc at Professor Torsten Schweid's Computational Structural Biology group in the University of Basel and the Swiss Institute of Bioinformatics, and I'll be leading the LIGATE project efforts. So my background is in computational biology, so at the interface of structural bioinformatics and machine learning. And one thing, so interdisciplinarity is something that's really important to me, both in the form of collaboration across distinct fields and in the form of multidisciplinary research, which, borrows and combines concepts from different areas in science and sometimes even from the arts. I'm a dual major in two quite different subjects, so computer science and the biological sciences. And I recently wrapped up my PhD thesis in bioinformatics. So I'm really excited to be part of the LIGATE consortium.
Can you tell us something about the role of your institution in LIGATE project?
So overall, the LIGATE project, it aims to create this world-class computer-aided drug design platform. And within this project, I'll be working on benchmarking and validating the capability of the platform to find accurate ligand properties using structural bioinformatics and machine learning techniques. And in collaboration with this research program from the University of Basel on microbial drug resistance, I'll also help select medically relevant drug targets. And then I'll be creating high-quality structural models of these targets to run through this platform. And it's this wonderful collaboration between researchers with all kinds of different expertise, right? From molecular simulations, high-performance computing, structure-based drug discovery, and artificial intelligence. And also there's a lot of pharmaceutical company partners across Europe involved. So we're really glad to be a part of it.
What are the steps, goals of the LIGATE project?
Yeah, so the overall goal of LIGATE is to become like this one-stop solution for in silico drug discovery. And historically, drug discovery, it's been quite a difficult problem. So there's an enormous number of small molecules in the chemical space. And to be able to tell which of these molecules can be drug candidates for a specific target, you have to use a range of computational techniques to identify, to prioritize, and to evaluate these candidates. And all of these kind of require a really long computational time to run. And it's also a challenging intellectual effort. So sometimes each step in the process is done independently by different researchers and different institutions, which makes it even harder to put all these components together. So in LIGATE, what we're going to do is to create this novel, polished pipeline, which anyone can use with relative ease and which can be run much faster to respond to worldwide crises like the current pandemic. We'll be using state-of-the-art structure-based machine learning techniques to effectively and efficiently prioritize the available candidates and the latest high-performance computing resources to run the entire pipeline in a much shorter time frame. And this focus on protein structure and structural modeling is really important, as we've seen some really incredible improvements in this field. And the focus on benchmarking is really important as well, because this makes sure that the entire system is reliable, that it's easy to use, it's easy to improve, it works well, and it also works on all kinds of edge cases. And we're going to automate the benchmark system, which means that we'll be able to continuously improve the platform by swapping in better techniques and seeing what kind of effect they have. And this kind of quality assurance, it's played a really important role in science before, and I expect that it'll be a significant factor in the success of this project. So the current pandemic has basically shown us again that working together by pooling our resources and our brain power is really important and it's impactful. And with this kind of extensive international collaboration, our ambition is to just come up with a bunch of innovative techniques that make the entire process of finding drug candidates faster, to make it smoother, and it's also going to be more reliable.
Okay, and what do you feel are the benefits for the European community and for the society in general?
The ambition of the LIGATE project is to offer the medical community this reliable and validated platform that can run a full in silico drug discovery pipeline in less than a day. This means that we as a society can be better in addressing public health emergency, like the current COVID-19 pandemic, and also with pathogenic diseases like West Nile, like Ebola and tuberculosis, which affects a lot of developing countries. And the platform will be able to also handle variation, like, for example, the Delta variant of the SARS-CoV-2 virus going around, and drug resistance as well. So all in all, we'll end up with sort of this unique software stack that could really help to improve drug design capability and thereby hopefully reduce quite a lot the time to market for new drugs.
Would you be the major improvements in the pharmacological, medical, and computer research fields, in your opinion?
Yeah, so in the pharmacological field, I think the algorithms that will be developed as part of this project are going to allow screening really huge libraries of compounds. So, and they also have the potential to really improve the accuracy of predictions. And of course, all of these methods are going to be made available to the scientific community. So it could really easily fuel further research. In the medical field, this capability of LIGATE to run virtual screening pipelines in days rather than months is going to allow researchers to really respond more efficiently to emerging and existing diseases, and to be prepared to address things like variants and drug resistance and so on. In the computational field, so this focus on high performance computing means that we can make efficient use of both current and future supercomputers. And there's going to be this feedback loop that will help improve customization of hardware, energy efficient scheduling, and so on. And this is going to benefit probably a wide range of algorithms, not just those related to drug design. And finally, we're going to demonstrate the platform on these few drug targets for infectious diseases with drug resistance. And this will essentially bring together these advances from all these different fields to solve something that's really a highly pressing real-world problem.
Thank you so much, Janani, for joining us today at this podcast, and thank you, our listeners. If you have any question about today's show, you can get in touch with LIGATE Twitter, and feel free to subscribe to Chelonia.Swiss website and be part of the community. In the meantime, stay tuned for our next interview. Thank you.